Good morning, all y'all. There's a shout out to Southwest Missourians and Texans who come on here. So we've been talking about cholesterol and statins. I've kept telling you, I would tell you my weight loss story. Hi, Linda. Hi, Eileen. So I'm going to do that, and then I'm going to give you a list, evidence-based information. Good morning, Linda. Evidence-based, and I'll put up the article I got this from. That's from Healthline from last summer. So there's little links, so you can actually see that there's science based on these 27 tips we're going to do. Okay, so the week, I was just saying this morning, the week I turned, it seems like every time I turn or start a new decade or end a decade, depending on how you look at it, something different happens health-wise. So when I turned 40, I noticed the week that I turned 40, I started getting out of bed and my knees would crack, kind of crackle and pop. That has gotten better, I think, but was not something I noticed. The week I turned 50, I realized that I was fat. I was heavy. I was too heavy. So I weighed 205 pounds. I went to see my doctor in Midwest City, Oklahoma. She's a St. Louis University med school graduate. So same school I did my undergraduate training in. And sure enough, she was griping at me, little bitty physician. She was notorious for diagnosing everybody as obese. And I never actually looked to see if she put that code on my medical record, but my guess is that she did. And so what she wanted me to do, and I was running blood pressures of 180 over 110 pretty routinely. So she put me on losartan, I believe, which is an ACE inhibitor. We talked about that with the COVID thing. And then she wrote me a prescription for Lipitor. She did my labs, and I weighed 205 pounds. So my BMI was, body mass index, I think was 28 or 29. And she sent me to a cardiologist friend of mine and had me do a treadmill test and a nuclear medicine scan, all of which I passed. So I got through. That's what's called the Bruce protocol. I had a nuclear medicine scan. He agreed with her recommendations. What I didn't want to do is take Lipitor, so I didn't. I did take my losartan, and that did help with my blood pressure. But at 205 pounds, I thought, okay. On my labs, I had a total cholesterol of 286. My LDL cholesterol was 199. My triglycerides were high. My HDL cholesterol was under 40, so 37. And I embarked on a weight loss journey. And how I did it was with an HCG diet. It's been around since 1957. The FDA says it doesn't work. Well, it's actually 74 years old now, and it does work. I've used it on people since I did it. And you drop down to a 500 calorie a day intake and take your HCG, which mobilizes stored body fat. And literally the weight just kind of dropped off of me. It started in my face and it just kind of dropped down until, all the weight was off of my abdominal area. And 31 days after starting that, I weighed 163 pounds. So from 205 to 163 in 31 days. And then I stopped the HCG and I went on a maintenance protocol for 3 weeks, which is what most people goof up. They say, well, I did a diet and it didn't work. Hey, Brandy, it didn't work. I gained all the weight back. Well, part of the way of doing that is a maintenance phase of that particular diet where you basically don't eat carbohydrates at all, high protein, high fat, basically an Atkins ketogenic diet for 3 weeks, and that resets the leptin levels in your body that's stored in body fat. So 3 weeks into, and what I had for breakfast is I would have 3 fried eggs cooked in butter and 6 pieces of bacon every morning. And then the rest of the time I ate pretty much all the green stuff that I wanted. But then I measured, of course, I'm a chemist, so I had a little food scale, and I would measure what I was eating, and I would calculate the caloric intake. And my caloric intake was I had to calculate it, was 2,100 calories. And I would stick right on that. I would get as close to 2,100 calories as I could by weighing food and calculating calories. I redid my labs and sent them to my doctor about 6:30 at night. And at 8 in the morning, she called me. And she said, "You sent me the wrong person's labs. These can't be yours. It's impossible." And I said, "Well, no, I weigh 163 pounds, Dr. Peterson." And I said, so I went and said hi to her so she could see that I had actually lost all this weight. And so from the time that she had put me on a high blood pressure medication and wanted me to take Lipitor, which I didn't, so 7 weeks passed and I'd lost 42 pounds. And my cholesterol level was 131. My LDL cholesterol level was 133, I believe. My HDL had risen to 44, and my total cholesterol was 171, I think, something like that. And so if you add the LDL and all that together, I was running 171 down from 286 and all. And I told her, I said, "I've been eating bacon and eggs for 3 weeks every morning." And she said, "Well, that's just not possible." And I told her, I said, "You need to quit telling your patients that they can't lose weight without drugs and this and that and the other thing. And one of the worst things you can do is basically do one of the fad diets." So what we're going to talk about on these 27 tips is don't diet. Now I'm going to say that, I say that, and then I told you I did an HCG diet. And the way I maintained that weight loss was I basically went to eating no simple sugars, no carbohydrates, or very little carbohydrates. I think I stayed at around 20 grams of carbohydrates a day, and I maintained that weight loss. I weighed 165-ish for about 8 years. And then last year I did this again, not with HCG, I did it with a low carb, high fat diet. So my doctor, I told you I did my cholesterol, it was 246. He said, "Well, your cholesterol sucks. I want you to take Lipitor." I said, "No." I said, "I'll take care of it." So I went on a low carb, high natural fat diet and lost 20 pounds in 7 weeks, I think. So I was at 188, I think, and I lost down to 165 to 166, and then I still maintain that between 165 and 170. 170 is probably about right. And I can do that if I just pay attention to carbs. And so if I stay away from carbs, I'm good. I have my labs done at Life Extension. You know, I keep talking about doing direct access labs. I just ordered what I wanted. And here's the ones I did in February. And so my LDL is 172. My total cholesterol, 261. And based on the research I told you Monday or Friday, I think it was, for a guy that's about to turn 60, that's just about right. So ideal, I'm a little bit high on total cholesterol. My LDL is actually in a good range for my age. So remember, if you get under 160, and I'm at 172, if you get under 160, you start having cardiovascular disease risk. Hi, Tammy. Hi, Christy. Abby, sorry about the meeting, but this will be up later. Okay, so I think I'm okay. I think I probably weigh about 172. I do not have a scale. I tell people if you're trying to weight manage, just don't use a scale. Kind of look at what your body looks like and how your clothes are fitting. That's actually less stressful than people weighing themselves every morning. So, okay, so 27 evidence-based health and nutrition tips. I'll put the article up in the comments when I get done. Okay, so and each tip has several references that are clickable, and you can go right to the study that shows you where these tips come from. Okay, so first one, and you probably know, everybody knows this. Don't drink sugar. So the calories that you drink, especially in high fructose corn syrup soda pops, they're not measured in your brain the same way as sugar that you eat does. So it's measured differently. So what happens when you drink sugary drinks is you actually eat more carbohydrates. So you're over, first of all, you're getting too many sugar calories, and you're eating sugar and carbohydrates on top of that, more so than if you just drink something else, fruit juice. Well, we'll talk about fruit juice. So the thing right now that I crave the most, and I don't know why, probably because I don't eat enough vegetables, is V8 juice and Clamato. So vegetable juice. It's like, in the middle of the night, I get up and I drink a glass of it. So right now I'm in a vegetable juice craze. Fruit juices specifically. So once again, I told you Monday, you got to read labels. You have to read labels. Know what you're putting in your body. So sugary drinks associated with obesity, type 2 diabetes, heart disease, many other health problems. The links are in the article. And if you just pick up a fruit juice like Ocean Spray, I'm not picking on Ocean Spray, but any of the fruit juices, there's 28 grams of sugar per dose or per serving. So you got to pay attention when they give you those labels on the nutritional content of what you're eating. It's per serving, and you have to look up what a serving is. So a lot of times they will reduce the labels and say a serving is 4 ounces when you're going to drink 8. And so whatever it is, you have to double it. I mean, you have to pay attention to how much you're taking. And a serving to a food company is really not a whole lot most of the time. So you really have to pay attention to labels. And then if you go to the lights and the diet ones, the diet ones have their own issues, but you still get carbohydrates. And I think the fruit juice light, trying to think how many grams of carbohydrates are in a diet fruit juice, but there is one, I think it's the light one, that has 5 grams of carbs per serving. Okay, so sugar. Okay, eat nuts, number 2. Very healthy, especially nuts that are high in fat. They have magnesium, vitamin E, fiber, other nutrients in them. Yeah, V8 is good. I love that drink, Linda. I drink it all the time. Okay, so a nut or nuts can help you lose weight and help you fight type 2 diabetes and heart disease. Okay, and then you don't absorb about 10, maybe 15% of the calories of the nuts that you're eating. One study, clickable in the article, showed that almonds increase weight loss, okay, by 62%. Compared to just changing from simple to complex carbohydrates in your diet. So almonds were kind of the mainstay. After I lost those 42 pounds, I would eat 1 ounce of almonds, I think twice a day, and calculate out the calories and all that. Okay, number 3, avoid junk food. Everybody should know that. You need to eat real food. Okay, so processed junk food, fast food, they're engineered specifically to trigger dopamine release, your pleasure center. So remember, dopamine is the basis of all addiction. So you can get people food addicted. That's why people can't stay away from certain things. I saw a live video review of a lady in her car eating that KFC new sandwich that is a chicken sandwich. And the bread is 2 glazed donuts. Okay, and she, she was eating it, and apparently she thought it was great. I'm not sure I'm willing to do that, but that's designed. I'm sure they've done the psychology behind glazed donuts and fried chicken sandwiches. Okay, so usually processed food has very little fiber. It's stripped out. Protein, micronutrients, but it's high in sugar and refined grains. So basically, you're eating empty calories. It does fill you up, but it's pretty much empty. Actually, Linda, I tell people to eat full-fat yogurt. It's better for you. Plain is fine, but full-fat yogurt, specifically Greek yogurt, is what most nutritionists recommend. And if Tammy was on here, she could argue with me. And we're going to do that Friday night thing on Facebook Live with my buddy in Norman, Oklahoma, on the Art of Floundering podcast, where we have a little panel of people where you can call in and ask questions or send comments. So that way I can kind of banter back and forth. Okay, number 4, do not fear coffee. Okay, it's high in antioxidants. And coffee drinkers actually live longer, reduces type 2 diabetes and Parkinson's and Alzheimer's disease, whole bunch of other illnesses. I think there's 6 references on coffee. Now, should you drink it all day long like I did when I was an obstetrician? The last thing I would do is have a cup of coffee at midnight and then go to bed. But usually I'm about 2 cups a day at this point. Number 5, eat fatty fish. And we talked about this Monday. Salmon is a wonderful fatty fish. Not everybody likes fish. So if you don't like fish, you can get your fish stuff from omega-3 fish oil supplements. And I've found several that don't have that fish aftertaste. A lot of people don't like that fish aftertaste. Okay, number 6, get enough sleep. We did a whole thing on insomnia about 3 weeks ago. So quality sleep is important. It's the first part of my shining protocol. How much are you sleeping? 7.5 hours uninterrupted is the goal. You actually gain weight if you're not sleeping. So you lose weight if you're sleeping. That sounds stupid, but it's true. So poor sleep makes you insulin resistant. It disrupts your appetite hormones, and it reduces your physical and mental performance to the level of you basically have the same impairment as somebody who is driving while intoxicated. It's one of the strongest individual risk factors for weight gain and obesity, just inadequate sleep. Yes, shrimp. I eat shrimp. I had shrimp stir fry last night. So shrimp's good. It's another good fish. I kind of cook it raw, so I get the raw kind, and then I stir it all up with all kinds of stuff because the ones that are pre-cooked won't take that taste in. Number 7, take care of gut health. Okay, fiber will help your gut microbiome. So will probiotics. Okay, so a disruption in your bacteria, and remember your gut is your second brain, is linked to serious disease, including obesity. Okay, so the probiotic supplements, I usually recommend those for people, especially if they have gut health issues overall. So fiber functions as a fuel for your gut bacteria. And you remember you got 6 trillion somatic cells, well, 6 trillion cells in your body, and you have 60 trillion bacteria in you all the time. 370 trillion viruses, basically. Okay, 8, drink some water, especially before meals. So if you drink about 2 glasses of water 30 minutes before you eat, it increases your metabolism, okay? And it boosts the number of calories you burn. So what you want is 2 liters of water a day. And so I did that when I was on the HCG protocol, 500 calories. It took me 30 minutes to eat them. So I did 250 calorie meals twice a day, and I drank 2 liters of water. So I bought a 2 liter container, basically that was for storage from Target, and I just carried it around with me at work. And the goal was to get that 2 liters in. And it's amazing, most hunger is thirst. So people think they're hungry, they drink some water, they're not hungry, really. And then if you drink water 30 minutes before you eat, you probably will not overeat. And remember, take 20 minutes to eat. Okay, so number 9, don't burn your meat or overcook it. So it's high in protein, so it's part of the ketogenic approach to weight loss and weight management. But you can get harmful compounds if you overcook it. Okay, so I'll tell you a little quickie story. There was my surgery partner in Oklahoma City. We went out to lunch one day at Cimarron Steakhouse on Meridian, just north of 10th and Meridian. Hey, Connie. And we decided we were going to have steak for lunch. So as usual, I ordered my steak medium rare. He ordered hers well done. And I took my shoe off and I said, why didn't you just eat this? That well done steak's gonna taste just like this shoe. And I did it in a restaurant. I wouldn't do that these days, I guess. Coronavirus days. Okay, number 10, avoid bright lights before sleep. We talked about that 3 weeks ago with the insomniac attack. Bright lights will reduce your production of melatonin. You can wear a mask. They've got filtered glasses, kind of amber tinted glasses that can block blue light, and it's blue light. So watching TV, playing around on your phone, looking at your laptop is blue light. And if you're doing that right before you go to sleep, it's going to disrupt things for you. Hey, Andrea. Okay, number 11, take vitamin D3. We talked a whole thing on the sunshine hormone. Usually 4,000 or 5,000 international units a day. Sunshine by itself typically won't do it. Every vitamin D level I've done on people that have tans has been 30, low 30s or lower. And I told you about the couple that have the cabin or house in the Caribbean, always tan. Their vitamin D level was, I think, 11 and 12 in that couple. Number 12, eat fruits and vegetables. Same thing your mom and your grandma told you. So they're prebiotic fiber in fruits and vegetables, vitamins, minerals, antioxidants. You typically live longer. And this is the basics of Mediterranean diet. So fruits and vegetables and fatty fish is the kind of the Mediterranean diet. Hey, Sarah. So you live longer, lowers your risk of heart disease, type 2 diabetes, and obesity. Okay. And like I said, depends on the vegetable. I kind of don't like cooked vegetables. I like them raw. But I drink that vegetable juice. And the spicy one, Corey, is great, but I couldn't find it yesterday when I went to the store. So I guess spicy V8 has become a thing, at least here in Boonville. Okay, number 13. I was going to tell you my former partner, Dr. Williams in Oklahoma City, specifically was talking last night about protecting, going out in public, protecting yourself, washing hands, all that. But he basically thinks to keep your immunity strong and keep yourself healthy, that everybody should be taking a vitamin, multivitamin, and zinc during this pandemic. And I think the multivitamin is just a good idea. You just got to find a good one. And the best way to tell a multivitamin actually gets in your body is to put one of them in an 8-ounce glass of water and walk away and come back 30 minutes later and see how much of it's dissolved. Because it's going to be out of your stomach and into your duodenum about 30 minutes after you swallow it. So you want a lot of it to dissolve within 30 or at 30 minutes. So if it's just still there, hey, morning, Ross. If it's still there 30 minutes later, it's just going to pass through you. So you're not really getting it. The best way to take a multivitamin is drink it. You can find multivitamin liquid or a powder, and you mix it up that way. Gel caps, if you can find it. And then there is a company, I met a guy from Germany who has, and I cannot think of the name of this company, but he makes they look like little dipping dots. And he will formulate, like if I did your labs and said, okay, this is the kind of nutritional support that this person needs in their vitamins and supplements and herbals and all that, he will make a custom made nutritional supplement specifically based on your labs. They look like little dipping dots. And he sells you a little spoon that has a weight on it. So if it's 5 grams of this dipping dot thing, then you put it in your mouth, 90% absorption within 30 minutes. So I designed one of those for the Oklahoma Men's Clinic. The first one I designed was $750 a month, so I had to redesign it. It was too expensive. Hey, Verona. Okay, number 13, eat protein. Make sure it's enough. Okay, this is important for weight loss. It's the base. High natural fat and moderate protein is the basis of ketogenic weight loss. So protein boosts metabolism. So you notice I like bacon and eggs, and it seems like I've used a bacon or an egg or a combination of the two for the pictures for these talks for the last week and a half. So I talked to a guy yesterday, health coach consult. And this guy, he said, sorry, doc, I've gained 48 pounds in the last 2 months. And so I said, well, a lot of people are doing that with their hibernation and whatever they're doing. He says, no, he says that's a good excuse, but he says, it's just me. He said, I eat whatever I want, and I put on 48 pounds in 8 weeks. So I told him, couple of years ago that, well, Linda, you're at the weight where you're maintenance. You're not going to lose weight if you eat proteins, just moderate protein. You just, like, I'm going to say 40% of your calories protein, less than 20 grams of carbs, and most of the diet on ketogenics is natural fat and protein, so higher fat than protein. Okay, so anyway, so I told this guy a year or so ago, I said, okay, you're working on your weight loss. He is a gym guy, and of course the gyms have been closed. And he says, well, it's not that, I've just been eating bad. Hey, Tori, and he said, I remember you talking about bacon and eggs in the morning. And I said, right. And I said, I got one better for you. I found a cookbook, a recipe book that's ketogenic. That's called the Butter and Bacon Cookbook. And I told him I'd send it to him. It's 150 recipes, including desserts that are all ketogenic friendly. But most of it's protein and natural fat. Okay, so protein, kind of a big deal. Reduces cravings. Carbs actually increase carb craving. So, the goal really is 20 grams for carbohydrate, 20 grams. So low carbohydrate is 20 grams or less per day. Reasonable is 50 grams a day. Okay is less than 100 grams a day. You got to read the label and see how much you're eating of it. Number 14, do some cardio. That doesn't mean run the Boston Marathon. That means walk. Get your heart rate up. So instead of maybe eating and then sitting down to watch Netflix, you get up and take the dog for a walk, or, just walk around a block 20, 30 minutes, 3 times a week. If you walk every night, so if they say 20 minutes of cardio 3 times a week is 1 hour. So if you walked for 15 minutes 7 days a week, you're past that hour. Just walk briskly. Okay. So it reduces belly fat, and belly fat is inflammatory. The stuff that is not necessarily beer guts. Everybody says, ooh, that guy must like beer. Nope. There's lots of people that I've met, men, that have, they hold their weight in their tummy. Most of them are testosterone deficient or suboptimal, and they don't do anything physical. So that helps with reduced belly fat. And belly fat is inflammatory, and it attacks your heart. That's pretty well documented. Okay, number 15, everybody knows this. Don't smoke, don't do drugs, drink in moderation. If you smoke or abuse drugs or misuse drugs, I don't like the term abuse. I don't like the term alcoholic. I don't like the term drug addict. I really don't like the terms substance abuse, maybe misuse, but abuse is a little negatively connotated word. So alcohol in moderation. If you tend to drink too much, just don't drink, right? So in this article, they say, tackle the smoking and the misuse of drugs and alcohol first, and then diet and exercise can wait till later, although I think you can do both at the same time. Number 16, extra virgin olive oil. That's the best way to cook. Now you got to watch the temperatures and the burn, hot versus moderate, and extra virgin oil can actually kind of burn if you need something hot. So there's better oils for that. But the heart healthy one is extra virgin olive oil. So it's loaded with monounsaturated fats and lots of antioxidants, and it fights inflammation. I use it almost every day. So I'm doing something with olive oil. It benefits the heart. And there's, people that consume garlic is another one. So, who doesn't put garlic in olive oil, right? So both of those are actually reduces your risk of mortality and dying from heart attacks and strokes. Pretty simple thing to do. If you like it, I'm kind of a garlic person. I probably smell like it all the time. And I love garlic mixed in with extra virgin olive oil. Number 17, minimize sugar. I told you Monday, the anti-aging guy spent 1 hour talking about how sugar was more addictive and harmful than heroin. So if you had to pick something to misuse, it would be less bad for you to use heroin than sugar. Okay, so It's the worst ingredient in a Western modern diet. So linked to obesity, type 2 diabetes, heart disease, lots of cancers. If you need, and so a guy that usually is on here, he's not here this morning, he uses agave. I use stevia a lot, and I cook with stevia. It tastes pretty much the same as sugar, and you don't absorb it. Not everybody likes the taste of stevia or any other kind of sugar substitute. And then the aspartame, I can probably do a whole one of these just on the dangers of aspartame in all these little diet things that people think are helping them. It's actually making especially a diet soda, actually makes you gain more weight and more insulin resistance. 18, don't eat a lot of refined carbohydrates. So they've been processed, the fiber's been removed, it's not helping your gut health. Okay, so, and you typically overeat, like I said earlier, if you eat too much simple sugars. So simple sugars, anything white, right? So potatoes, and actually ketogenic eating involves not eating anything that grows beneath the ground. So carrots, potatoes, you want to eat your fruits and vegetables that grow above the ground. It's the easiest way to say that. Okay, number 19, do not fear saturated fat. It's been controversial. Okay, so saturated fat does raise cholesterol levels, but it lowers LDL and raises HDL. So like I told you Monday or Friday, if you do a total cholesterol level on somebody, that doesn't tell you anything, because saturated fat raises HDL levels, what everybody thinks is the good cholesterol taxi, and lowers LDL levels, the bad cholesterol taxi. Okay, so lots of studies, and they're in this article. Hundreds of thousands of people have shown a reason to question the association between saturated fat intake and heart disease. Okay, so the exact opposite of what the U.S. food pyramid says. And I think we proved over these last 2 or 3 classes, that cholesterol isn't bad, and everything you've been taught about low fat is in error and is wrong, right? Number 20, lift heavy things. Yes, eggplant is fine, Linda. Lift heavy things. So I tell men that are over 40, even if they're on testosterone as a replacement, I tell them you need to push and pull things. So lift weights, not 300-pound bench presses and all that, just something, lift things. And that actually improves testosterone production, the natural internal testosterone production from the testicles. Just something that simple. Okay, number 21, avoid artificial trans fat. Most of that's been banned in the US, okay, but not everywhere has the ban gone fully into effect. So you kind of have to know the difference between cis and trans fats. And again, you've got to just look them up and look at labels, right? 22, herbs and spices. Cook with herbs and spices. Everything I cook, I'm throwing cayenne pepper in, ginger, turmeric. They're all anti-inflammatory, antioxidants, and they just make food taste better. Of course, garlic, okay, just the way I do it. 23, be social. And here's one of the problems in this pandemic. Take care of your relationships and be social. They're important for mental well-being and your physical health. I talked about the things other than death that the COVID pandemic that may affect your health. And so one of the panel members on the Art of Floundering podcast we do Fridays at 7 wanted to do that as a cute question and answer specifically for mental health effects of social isolation. She's a licensed professional counselor. She was a patient of mine in Oklahoma City. And that's kind of her thing. And when we did that first one Friday night, it was very interesting, her viewpoint from a mental health perspective on all the things that we were discussing just in general about health. Number 24, track your food intake occasionally. And I tell you, to pay attention to the labels. That's sort of tracking your food intake. But occasionally just make sure that you're A, getting enough calories, and B, not getting too many calories. And you can kind of calculate, there's caloric calculators and nutrition trackers that you can use that based on your body mass index and your body type as to how much calories is okay for you, or what you should be. So if you get too little, that's a problem. If you get too much, that can be a problem. Okay, number 25, excess belly fat. We talked about this earlier. It is inflammatory. It grows around your organs. You can see it on ultrasound, and it attacks your heart, specifically the belly fat, especially in men that have lower or low normal testosterone levels that aren't optimized. Okay, so it's strongly linked to metabolic disease, so metabolic syndrome, insulin resistance, type 2 diabetes, and obesity. And actually, I think, we talked about metabolic syndrome and waist size. So ideally, a man should have a waist size less than 40, women less than 35. So there's kind of evidence that your waist size is more important than your weight. Okay, so, and that's easy to measure, obviously. So cutting your simple carbs, eating more protein and fiber and natural fat will help you get rid of belly fat. Number 26, do not go on a diet. Get nutritional advice. There's plenty of nutritional health coaches, one of whom is on the podcast we do on Friday nights. She's also a certified physical trainer, but she spent years doing nutritional certifications, et cetera, and she is of the same ilk that people that diet, they yo-yo, and that's actually probably worse. What you got to do is basically change your lifestyle. Okay, dieting is one of the strongest predictors for future weight gain. Look it up. It's a clickable link in this article I'll put up. As soon as I get done, I'm going to put this in the comments. Okay, so weight loss will follow as you do these little 27 tips we're talking about. And, about half of them are nutritional, right? Okay, number 27, and the reason that I keep putting eggs up as a picture on what I'm going to talk about. Eat eggs, yolk and all, is the 27th thing. So they're so nutritious, whole eggs, that they're termed nature's multivitamin. Okay, it is a myth that eggs are bad for you because of their cholesterol content. The studies are there, click and read them. No effect on blood cholesterol in the majority of people who eat eggs. Okay. And a massa review, 263,938 people in this study, egg intake had no association with heart disease risk. Hey, Jesse, miss you too. Wish I got to deliver your baby. Would have been fun. We'd have had a good time. Okay, eggs are one of the planet's most nutritional food, specifically the yolk. That's where all the nutrition is, so eat the yolk. Okay, so few simple steps, really. That's 27 of them that pretty much go a long way toward having you or allowing you to have a healthy weight and a healthy lifestyle, and keep your heart disease risk and all that under your control rather than relying on a pharmaceutical drug, specifically the statins. Okay, so that's the end of my diatribe about the food pyramid, the statins, cholesterol, heart disease, stuff that you can do, how to lose weight and all that. I do the weight loss thing. I've done that for probably since I did that dietary or that weight loss in it would be 2010. So I do a lot of weight management for people. I will message you, Jesse, privately when I get done. We'll talk about what you want to talk about. So Friday night, 7 p.m., Facebook Live on, it's called the Art of Floundering podcast. So if you want to join us, we have a panel of people just hanging out and talking about health and mental health and training and how to eat and whatever people call in. Our first question Friday was from Australia. So it's a pretty good dialogue. Hopefully it just keeps getting better. Subscribe to that YouTube. It's Art of Floundering podcast. We're trying to get it where we can use YouTube as the medium for doing this. So I will talk to you all on Friday. I think I've got a COVID update I'm going to do, and we'll talk about what's the latest and greatest, and probably talk about Plaquenil and how the fact that a medication has become politicized, somehow it's a political issue. So I'm about done, but I'll have it up. You can watch it later, and I'll talk to you all Friday at 9:30. Okay. Thanks. Have a great day. Peace and health to all of you. Bye.